It's 17 hours.
Good evening, everyone. We're going to give a few more minutes before we start, just trying to sort out a few things at our end. Please bear with us.
Is Sir in yet?
Dr. Mohan, we'll start in a few minutes.
Yeah, sure, absolutely.
Samuel, shall we start?
Yes, we can go ahead.
Thank you. Dr. Mohan?
Yeah.
Should we?
Yeah.
Okay, thank you very much. Very warm welcome, everyone. My name is Rabindra Jhunjhunwala, and this is Lockdown Conversation number 6. Every other weekend, I've been getting a special guest, hosting them on this show, trying to disseminate information. And it started off small, but obviously it's taken another shape, and we continue to do it. The pattern is same as before, about 50 minutes of conversation with our guest. We have collected several questions, and Doctor is going to go through those questions. He's going to talk about ENT and the manifestation, various other topics with respect to his specialty. And the last 5-10 minutes, we leave it to question and answers if there are any live questions which keep coming at that stage. We are parallelly streaming this live on Facebook, so a recording will be available for everyone to watch. With that, I'm going to probably get started with the topic at hand. As I mentioned, it's a conversation format. It's free flowing, and we'll keep it that way. I hope you're taking good care of yourself and adapting well to the new normal. These are unprecedented times, and it seems it's going to continue for some more time. I'm also very glad to note that I can see friends from across the borders join. I see friends from Pakistan, Sri Lanka, Bangladesh, several guests from overseas. So, Dr. Mohan, just FYI,
Hi.
there are lots of people, not just from Bombay and Calcutta, but other cities and other countries. So, ladies and gentlemen, following the sensitive topic on mental health last Sunday, we moved to another important topic where we also find some stigma attached, and we'll come to it. But if I may draw a parallel between eyes and ears, how easily we adopt and we wear glasses, to correct our vision. But have you ever thought of comparing it with how many actually want to wear a hearing aid? There is some amount of stigma attached. And Helen Keller said it very beautifully. She said, blindness cuts one off from things, whereas deafness cuts one off from people. So that's what we are confronted with today. I went back and checked some data, and the World Health Organization had a report in 2018 on prevention of deafness. And based on the WHO's report, it is estimated that there are more than 6.1% of the people in the world who live with hearing loss or some form of hearing disorder, of which 7% are actually children, which is a very high number. And one third of those 6.1% of the world population are those above the age of 65 years. And the other fact which I found very surprising is the people with disabling hearing loss is going to grow and grow substantially over the years. It is in 2018, it was about 466 million. It is projected that by 2030, it's going to go up to 630 million. And by 2050, up to 900 million. And the other interesting data which I picked up from WHO's report was a graph which showed negative relationship between prevalence of disabling hearing loss in children and parents' literacy rates, which in a nutshell means that prevalence in children decreases when parents' literacy rate increases. So there is somewhere a lack of knowledge amongst the parents, amongst the elders. And that is what I think we are going to try and set correct as part of the conversation today. So let me welcome our guest and special speaker, Dr. N.V.K. Mohan from Calcutta. Dr. Mohan, a very warm welcome to you.
Thank you very much, Mr. Jhunjhunwala. Good evening, friends, ladies and gentlemen. I'm Dr. N.V.K. Mohan, as Mr. Jhunjhunwala so kindly said. I'm a practicing ENT surgeon with a special interest in diseases of the ear. Right?
I think
I'm really glad that Mr. Jhunjhunwala has given me the opportunity to come and talk to you and probably try and spread some awareness about this problem that we face day in and day out, and hopefully we shall make some change.
Thank you very much for coming on the show, Dr. Mohan. For our guests, maybe
is all mine.
If I may very quickly introduce you, sir, just so that everybody has a little bit of background about yourself. You have close to 25 years of experience. You are a senior ENT surgeon at Medica ENT Institute in Calcutta. You were born and brought up in Durgapur, and you did your MBBS at the NRS Medical College in Calcutta. And thereafter, you have trained in general surgery and later in ENT from Indore and UK. I believe, sir, you came back to Calcutta in 2008 and have been there ever since your London stint. Although Dr. Mohan treats all kinds of ENT disorders, his area of special professional interest is diseases and surgery of the ear. And am I pronouncing it right, Dr. Mohan? Is it Cochlea implantation?
Cochlear implantation.
Cochlear implantation for the deaf and treatment and rehab of patients of vertigo. And Dr. Mohan, I very much liked on the personal front that you enjoy good food, as do I, and and you enjoy your wife's cakes. A complete family man, I must say. Interestingly, Dr. Mohan has his passion set in old Hindi music, and especially that of Muhammad Rafi and Indian classical instrument music. And I say this because we are going to cover a bit about music in the discussion and why it is relevant. For those of you who don't know, he's also a blogger and started recently, and he goes by the name of a surgeon and a dreamer. So feel free to stay connected with him on a surgeon and a dreamer. He's willing to be asked questions relating to health, and he will try and answer them as often as he can. Doctor, once again, I'm so very thankful to you for taking the time out and joining us today.
The pleasure is all mine.
We have a number of participants, number of families on the call, and as I mentioned, it is being telecast live on Facebook as well. I will conduct a poll a little later just to get a sense of the age group of attendees. So some of the questions that we take and some of the discussions that we have, there is some context. But for now, let's jump straight to the questions. And we have a fair bit of them, thanks to a lot of the attendees who have taken the trouble to ask those questions. So Dr. Mohan, may I ask you a very basic question to start with? What are the symptoms of COVID from the perspective of an ENT surgeon?
Yeah, very pertinent question given the times that we are in, Ravindra. See, we all know, and by this time it's even on the child's mind, that cough, a dry cough, a fever, sore throat, shortness of breath, these are what the usual symptoms are. And this is what most patients are presenting with. But there has been certain changes of late. And that is what I would like to highlight is that we have been seeing patients with sudden loss of sense of smell and also taste. It says Ghanayam adha bhojanam. So if you don't get the smell, you don't get the taste of food. So and in this case, it has been brought up by the British ENT Association that a lot of their patients were actually present. There were no other symptoms, but they were present.
Dr. Mohan, I seem to have lost you. Apologies about that, attendees. It seems that Dr. Mohan is having some network issues. We'll just give him a few more seconds. Dr. Mohan? Are you back, Dr. Mohan? You have to unmute yourself, sir. We lost you pretty much at the beginning. So maybe you want to start answering the question in terms of what are the symptoms?
The basic symptoms, the common symptoms which all children know is, even the children know now, is fever and a dry cough, shortness of breath, sore throat, pain in the throat. So these are the common symptoms. But of late, we've also been seeing patients with sense of loss of sense of smell and taste. This is very unusual, and sometimes these patients are having no other symptoms apart from the fact that they've lost their sense of taste and smell. So this is from the ENT perspective. And
as we learn more about the disease, are there any new facts which are emerging?
Yes, actually, it's a very interesting topic that you bring up. It's actually as there's a lot we don't know about the virus yet, as my friend says. She's a virologist in the NIH, Washington. Now, fact is, as time passes, we are seeing, especially in Calcutta, I would say, apparently the atypical presentations are increasing. What are these? Fatigue, headaches, no other symptoms, no fever, no shortness of breath, nothing. Fatigue and shortness and headaches. Then patients are having diarrhea, vomiting, and digestive tract symptoms. Also, sometimes they are presenting with cardiological issues. Even people who did not have cardiac problems before, they have been presenting with cardiac issues. And apart from that, sometimes there is disorientation or confusion, and these kind of symptoms are also coming up. Apart from the fact that there's a loss of sense of smell and taste. Recently, I mean, it's still unverified. I mean, there was a publication from China, not in a peer-reviewed journal, but apparently they have been noticing a sudden loss of hearing also as a symptom of COVID. We don't know yet. It's not been published in any peer-reviewed journal, but we have read a publication to that effect.
That's very interesting. If that were to be true, that would be definitely unheard of.
Yeah.
So, in the altered circumstances, how do we go about from here, and what should we do to safeguard our health, Dr. Mohan?
The first thing, it's a very pertinent point that we talk now, you bring up. See, the first thing that we must realize is that it's just the lockdown that has ended. The government is just easing out the lockdown. The virus hasn't gone anywhere, and it's not going anywhere in a hurry. So we will have to adjust to this new normal, as we say. And it so much so that there are government directives on the government website as well about the new normal. So the most important thing would be, wearing of masks and personal hygiene, basically. Very important to, be mindful of that. No handshakes, the namaste and the, wave in again, or just bow. But the thing is, we have to watch where our hands are. One thing that we have to keep in mind is that this disease spreads through fomites. What are fomites? Everyday objects. It could be your laptop screen, your the keypad, your mobile phone, your keys, your doorknobs, wallet, etc. So what do? I've stopped carrying my wallet. I just carry some money, and by and large, I try and pay electronically. So that's one way of avoiding contact, the minimum contact that we can have, and make sure we wash our hands very frequently. Now, this is, I mean, a lot has been said about all of this already. There's some things that I want to bring up, and that is, we've been seeing this this thing, is that, a lot of people are experiencing emotional turmoil. Now, that is a result, even children, actually, that is a result of the fact that children are not able to go out. We cannot let them out. And they're not able to see their friends, and they're, incarcerated in the house. I mean, they can't play. So they are getting affected emotionally. Even adults, there's been loss of livelihood or, severe compromise on that front. Again, not being able to go out frequently, and this constant fear. So, I mean, one thing that I would advocate, and this is very vital, is that we take care of our physical health as well as our mental well-being. These things can be very easily, overlooked. How do you take care of our physical health? We watch what we eat, and we do some exercises, say dance or something, listening to music. Music is a very good stress buster, and also charity and giving, just the act of giving, and spicy food apparently. And even indulging in engaging yourself in some pleasurable activity like solving the crossword or something. So what do these activities have to do? These activities actually, release certain chemicals in our brain, which are known as the feel-good hormones, and then it brings a sense of well-being. And here I'd like to quickly mention there was a question apparently from someone that they were they didn't like anything. They were feeling really down and out, and this is evident also in the sudden spurt in the number of suicides that you're seeing. So basically, people are feeling lonely, and what I would suggest is just talk to someone who is willing to listen without judging, without any prejudices. A close friend, your wife, your spouse, your child, or anyone. It could be a parent or anyone. Just talk it out. Just talk it out. If nothing, just call one of those mental health helplines. There is always a person who is just patiently listening. Just the act of listening can be very cathartic. To be heard can be very cathartic. And music definitely is, I mean, at least to me, it's a really good,
stress buster.
Stress buster.
So actually, last conversation we had Dr. Harish Shetty, who's a psychiatrist in Bombay and a friend of mine who has battled successfully depression. And we had this topic and we discussed it in great detail about coping mechanisms and how anxious and agitation can be dealt with. So it's interesting that you brought it up in this conversation. Clearly, there is a context here as well. Dr. Mohan, if I may just initiate the poll at this stage, because we're going to get into the critical questions. Those of you who are logged in, there is a poll which I have just launched, and it'll be up on your screen. There are 4 questions. If you don't mind, please responding to it. And those of you who are on Facebook watching this live, unfortunately, we may not have the poll appear for you. I will, however, repeat the question and the responses for the benefit of those on Facebook. So the first question is, what age group do you fall in? Below 40, 40 to 60, and 60 plus. Responses are coming in. Second one is, do you have children below the age of 15? Third one, if you're aware of any hearing issue in your immediate family. And last one is asking you, if it were necessary, would you be comfortable wearing a hearing aid? So 4 questions. We'll give a minute and a half to the attendees to respond, and we will then take it from there. For the benefit of those on Facebook, I will repeat the questions for you and leave you with the poll results. There are people still filling up, so I'm going to wait for a few more seconds, maybe 15 seconds more. Thank you. Almost all of you there, 80% have voted. So 4 questions on your screen. What age group do you fall in? Do you have children below the age of 15? Are you aware of any hearing issues in your immediate family? And if it were necessary, would you be comfortable wearing hearing aid? Since more than 80% have voted, I'm going to give last 5 seconds and then end the poll and project the results. Okay. So, Dr. Mohan, the results are in front of you.
Yeah.
A very high concentration of 40 to 60 on attending the Zoom call, not the Facebook. So there are 60% people who are attending who fall in the bracket of 40 to 60. And 60%, again, 60% don't have children below the age of 15. 60% are not aware of hearing issues in the immediate family. And Surprisingly, I'm surprised at this answer. If it were necessary, would you be comfortable wearing a hearing aid? 86% are saying yes. I'm truly surprised. I would have thought
That's a surprise.
it would be the other way around.
Absolutely.
So we'll get the poll out of the way. Dr. Mohan, we'll keep those figures in mind.
Yeah. Yeah.
And unless you had any thoughts on the results,
No, I am. Can you hear me?
yes.
Yeah. I'm kind of encouraged by the answer to the fourth question, because you see, if you go by the statistics from WHO, the World Health Organization, and even India, uh, more than 70% of people who actually need a hearing aid are not willing to accept it. But if 86% of the patient, people here are, willing to accept it, then hello.
We can hear you.
Yeah, yeah. Because looks like there's some problem with my internet. Anyway, so basically, very few people actually end up using it, and even in personal practice, we've seen, even when we ask elderly people coming in with hearing loss, and we tell them that you need to wear a hearing aid, you need a hearing aid, the level of acceptance is pretty low. I mean, at the moment they hear that, they kind of recoil, and they would be wearing glasses, but then they don't like the idea of wearing hearing aids. So I'm really surprised by this.
So let's move on to the questions, Dr. Mohan. And I wanted to understand specifically with children, how does hearing loss affect an individual? And I'm talking specifically of children here.
Okay, specifically of children, right?
Yeah.
See, I mean, basically, we have to understand one thing, that unless we hear, we cannot speak, because a child learns to speak only by emulating what the child is hearing. I'd like quickly, show one photograph here, one picture. It might
Can you
help.
this slide, please?
Yeah. So basically, what happens is, if you look at this picture, on the top left, you have the picture of the ear, the way we look at it from the front or behind. The blue light, small blue thing that you see is the eardrum, and there are three little bones, attached to it. And then inside, if you see to the extreme right of the picture, there is something like a shell. That is called the cochlea. That is the inner ear, and that is where the sound is, processed. It's 2.5 turns, almost like a the shell of a snail. And if you cut a cross section, you can see what we call the organ of Cochlea, the picture on your bottom left. And you see those blue little cylindrical things. These are called the hair cells. Now these hair cells, actually, what happens is, when the sound comes and hits the eardrum vibrates, and then the fluid inside this cochlea is made to move, and the hair cells actually sense this motion and convert it into an electrical energy, which then goes via the nerve to the brain. Now, a child who is born, a newborn, they have their inner ear formed to complete adult size, but this the ear is not connected to the other parts of the brain. Now, different parts of the brain actually work differently. One part helps us to hear, and then for us to comprehend that, or probably when you listen to a good music, it evokes a sense of emotion of pleasure. You hear a jarring sound or someone scolding you, you feel sad, or you feel it hurts the ears. So there's pain. So that's a different part of the brain that processes this. And then you hear a question, you want to answer it, a different part of the brain will dictate that function. So all these functions to be able to work in tandem, there needs to be connections. So think of it in this way. There's a road. There's a remote village, and there are no roads to it. Okay, so how will the people, commute from that place? So the same thing with the child's brain. The center for hearing, we can do away with the picture now, right? So the center for the hearing does not develop its connections within the brain to the other areas. And what that can do, that can, and that does not actually, these connections do not develop unless the child starts to hear. So if a child cannot hear, what happens is the child's cognitive function, the cognitive development, that gets affected. Children can become frustrated. Can you hear me? Yeah.
I can hear you. No, Dr. Mohan, you're frozen again.
And that.
Sorry, it seems your internet connection is not very good. You've frozen, Dr. Mohan. Apologies. Dr. Mohan, you'll have to unmute yourself. We couldn't hear you.
Oh, sorry. Yeah. Something.
In case you have a phone next to you and the Wi-Fi is on, please switch it off. That may be one.
That could be one. Let's see where I left my phone. That's right. Sorry.
In case the Wi-Fi is on.
Yeah, it is. Yeah, I'll switch that off. Yeah, sorry. So basically, what I was saying is that unless a child hears, a baby hears, they cannot talk. And it takes about a year for the baby, for the normal hearing baby to be able to utter some, sounds. Now, a part of the brain that actually hears needs to be connected with the different other parts of the brain. The central connections need to form for us to be able to process the sound that we are hearing, whether it's pleasant music or it's a horrible noise, a taxi honking at me, or someone abusing me, or someone praising me. Now, it's not just about the sound. There are emotions attached to these sounds, or to this auditory input. So pleasant music will, Rafi Saab will evoke, pleasure. A taxi horn will, irritate you. Someone abusing will hurt you. So, there's cognitive function involved as well. So unless the child is able to hear, these functions do not develop very well. So there can be cognitive, impairment in development. There can be compromised cognitive. In fact, even in adults who have been deprived of hearing for a while, they have lost their hearing down the line, and they have not been corrected. Even their cognitive function can decline. And it's been seen that even adults, if they have uncorrected hearing loss, they can also develop dementia and forgetfulness. So, it's got a lot, these connections, the brain can form these central connections only up to a certain age. Although the inner ear is formed to adult size at birth, these connections are not formed. So it's almost like, say you have got a remote village, and it's not connected by any road to the outside world. So how do the people commute? Unless there are people commuting, wanting to come to the city from there, the government will not see the need to lay a road. It's almost something similar. Unless the ear is the central part of the hearing ear, the part of the brain that is concerned with the hearing, that is the auditory cortex, as we call it. Unless that gets the sound, these central connections will not form. So it becomes very vital for us to, check the hearing of the baby. And it's the standard of care now in the world, universal hearing screening. Every baby who is born has a hearing screening done. And one last thing I'll add, although this was about children, the other thing that will add is about adults. When we see a lot of adults, elderly people developing hearing loss as a part of their aging process, that is hearing presbycusis, as we call it. When they can't hear for a long while, they start feeling alienated, and they can socially withdraw, and they can develop dementia. So it can have profound, far-reaching consequences if it's left uncorrected.
Understood. Thank you very much. And why is it then you say that hearing loss is a neglected condition? What do you mean by that?
It's the same. You mentioned this before. See, I mean, the common, this thing we have, the perception that we have is that the moment I wear a hearing aid, अरे वो तो बहरा हो गया, अरे भाई एक बार के बजाय 2 बार रिपीट करने को कहोगे तो नहीं कहेगा, तो नहीं सोचेगा कि आपको ऊंचा सुनता है. He'll still think that you cannot hear very well, but he'll not probably say it in front of you. He'll say it at the back. So, and nowadays, who cares what you have on your ears? You've got Bluetooth devices. You've got these what do they call them? Buds or something. What do they call them now? I'm very technically challenged. Yeah, earbuds, earpods, and headphones, etc., etc. You go out on the road, you see 10 people, you see 8 of them stuck something with something stuck in their ears. No one notices a hearing aid nowadays, and even they are so minute. But still, there's a stigma. They'll easily accept the glasses. In fact, they will accessorize it. They'll take pride in wearing a police or a diesel frame or a Mont Blanc. But when it comes to hearing it, it's strict no. And trouble is we probably don't give as much importance to what we call the quality of life. That you're missing out on conversation. That you're missing out on life. The little pleasures. You can't talk to your grandchild, or you can't talk to your friends, and you're still asking them to repeat, and you are thinking that they don't realize that you're hard of hearing. So this is a major, this stigmatization. This stigmatization of hearing loss is the major impediment, which leads people to neglect, and also the awareness. See, it's very frustrating to see patients who have developed sudden hearing loss not coming to us in the right time frame. They think, अरे कान में पानी चला गया होगा, वो कान में ताला लग गया. Now they'll accept that. It's quite easy to misinterpret a sudden onset hearing loss, and it can happen suddenly overnight. You just wake up to find that your hearing is gone. It can happen. Now, and they'll say, अच्छा देख लेते हैं, जुकाम लग गया होगा, अरे एसी के नीचे बैठ गया था. All kinds of things. The same person.
So
suddenly, if they can't see suddenly, they'll rush to the top.
Understood. So there are some questions coming in, and maybe I'm going to pick this question now. Since you mentioned about earpods, you see a number of children now are going through online schooling, and they are for extended period of time during the day, they're using a headphone.
Very pertinent.
That's one. Second is just generally speaking, is it a myth that headphone diminishes hearing capability? Though I see you wearing a big fat headphone, I'm assuming not. And third is linked to it. Dr. Mohan, is it better to use a loudspeaker? Like I'm not using earphones, whereas you are. So 2 or 3 questions combined, if you may throw some light on it.
Certainly. See, the first and a very important pertinent point that someone raised is about children being on online classes and being on the headphone for prolonged periods of time. Now, actually, to be honest, it does have an impact, and more importantly, when you have the in the earphones, there are quite a few things that can happen. One is the egress of wax can be affected. That's a very minor thing. You go to the doctor, you can remove. The most important thing is at what volume are you here listening? So nowadays, most devices, at least which are Bluetooth enabled, they will tell you whether you are raising the volume above the permissible limits. So you have to absolutely ensure that that is not happening. For parents, I'd say one thing: you should not be able to hear what your child is hearing on the headphones at 2 hands distance. If you can hear something 2 hands away from your child, what your child is hearing, so the child is hearing it at a very loud volume. And if we can maintain this loudness, then probably the amount of hours that they're using it for the studies maybe may not be that much of a problem. But certainly it's better off you're better off using the speaker and yeah.
Thank you.
Certainly better off.
So I'm going to move on to my prepared question, and one of which is, how is hearing loss detected in children? And is it like a painful process that we have to put the kid?
No. It's not at all painful. It's a very simple 5-minute test, almost like taking a temperature nowadays. I think I would request Dr. Santosh Agarwal sir to expound on that because sir, I've been fortunate enough to be working with sir off and on, and collaborating with him. And sir has got some vast experience, from the parents' side, counseling the parents. All children that are born are obviously seen by sir first. So I think I'll leave sir to expound on that.
Lovely. Just to very quickly give a background, Dr. Santosh Agarwal is a leading pediatrician in Calcutta, and it's a great opportunity to get Dr. Agarwal to respond to this. So please, maybe we'll ask you a few more questions since you are there.
Yes, sir.
Thank you very much, Rabindra, for the series of outstanding and phenomenal webinars that you've been conducting, which are benefiting one and all. Thank you very much, Dr. Mohan, for allowing me to come in. As Dr. Mohan had said, that the early signs of a child not hearing could be that he watches the TV or in school, is saying he's inattentive, or maybe that he states the question to be repeated, or his school performance is going down. I would say if we are picking hearing loss at that stage, we are in a bad state. We ought to pick up hearing loss today at the time of birth. And I must remind each and everyone who is attending this that every newborn baby at the time of birth should have a very simple, straightforward hearing test in the hospital itself, which is called OAE. It stands for Auto Acoustic Emission. The test is very simple, not painful, doesn't cost much, and it doesn't take more than 2 minutes to be done. Sometimes a baby may go home and that hospital does not have a setup to do the test. Then it's the parent's responsibility, along with the pediatrician, whoever is looking after, to remember that this has not been done. Because I recollect in the last 6 months, I've had 2 babies born in different parts of the country in very prominent hospitals, and they somehow missed to have this test. And both these babies had profound hearing loss, and they've got cochlear implants now. Had they been picked up at the time of birth, the outcome could have been different. So I think one of the important take-home messages today is that every baby born today should have a hearing test, which is called an OAE, a very simple, straightforward test. The way it's done is we just put a small probe into the baby's ear, and there's a microphone that gives a recording, and there is a pass or a fail. Most of the time it's a pass, which means the hearing is okay. It's a fail, baby is reassessed again, and we look deeply whether there is a cause for it. The causes of hearing not being present in a newborn baby could broadly be due to some genetic reasons, which is running in the family. There are many families where the parents or grandparents have a hearing issue, or it could be that the mother had some issues during pregnancy, like having an infection with certain viruses. The viruses are in a sort of a basket, as Ravindra, you call it. They're called TORCH, T-O-R-C-H. What it stands for is toxoplasmosis, which is an infection, rubella, herpes virus. Now we have Zika virus, and we have something called cytomegalovirus. All these viruses can cause hearing impairment in the newborn, along with other serious conditions. So I go to the other side of the thing. It's very important that a pregnant lady should not, as far as possible, have any viral infections, because they can affect the unborn baby, the baby who is growing. I think I go back on to Dr. Mohan, or does he want me to do a bit of development at the same time? Okay, sir, so I'll carry on with that. When babies develop,
have we lost Dr. Agarwal?
Yes, looks like we have lost Agarwal.
Maybe we'll come
no,
back.
No, I'm. Oh yeah, sir is back. Yeah.
Oh, he's here.
Yeah.
Please go on.
So, if we see, a baby's development is assessed when the baby is born, when he's 3 months old, 6 months old, 9 months old. And there are various parameters that we look at the baby in terms of how is the baby smiling. If the baby hears, the baby starts cooing, making noises, and then babbling, and then making monosyllables, and then this goes on. But if a baby who does not hear cannot enter into these areas, and it may be quite late for a first-time father and mother to understand that their baby, till he's 1 year old, is not hearing at all. So it's important for this test to be done. Back to Dr. Mohan, please.
Dr. Mohan, did you want to add anything?
No, I mean, sir has so beautifully explained everything. Yeah, I mean, basically, every child should have it, and that is the norm nowadays in the world. So, and even we are as an ENT association, and also, you know, from our Association of Cochlear Implant Group of India, Indian Society of Otology, and you know, the Indian Society Association of Otolaryngologists of India, the ENT Surgeons of India, we are all trying and pushing for this universal screening to be started in our country. I mean, to be given a major push in our country as well.
Okay. And Dr. Mohan, from your perspective, what would be the early signs of hearing loss in adults, children?
See, I mean, the first thing in children specifically, see, adults can basically more or less understand. One who has heard before can basically understand that, you know, they may not, you know, give it due importance, but they will understand that there's this thing. Sometimes there can be a small, you know, insignificant hearing loss, and that can be sometimes associated with a ringing noise. You know, what we call tinnitus. It could be any kind of noise, high-pitched noise or low-pitched humming noise, or whatever noise that's not actually present in the in your surroundings. So that could be one of the indications for an adult. For a child, I mean, see, like Sir said, all the I mean, every pediatrician will be assessing a baby who's born about when they are smiling, when they are, you know, turning their head to a rattle, etc., etc. I mean, there are certain, you know, guidelines that this is how a normal baby should be doing at this age, etc. So that is one thing. From an ENT perspective, how we understand and what we tell our parents to you know, to watch out for is, are the grades falling? Does the teacher complain that the child is inattentive in class? Does the child, you know, want the volume of the TV set higher? Sometimes, you know, what is again you know, this challenging is when there is one-sided hearing loss, what we call unilateral. One side is, completely lost. And these can be very challenging to, pick up unless they've had an OAE done at birth. What happens is the child will end up actually putting the good ear forward. They turn their head towards the good ear, they turn the good ear towards the speaker. So I've had a child, of 12 coming to me. She had an ear infection, which led her to do that. But her mother, who was a professor at BHU, she came to me telling me that she was putting her ear, the left ear ahead, and then we saw that she had a right ear problem. So these are some basic things, and also children who snore, who have frequent colds. These are children who have enlarged adenoids, and adenoids are just like tonsils. They are they are actually tonsils. They're called nasopharyngeal tonsils, except that the tonsils as we know it, they are present in the throat. Adenoids are present at the back of the nose, and these when these are enlarged inordinately, they can cause mouth breathing, snoring, and also what we call glue ear, one of the commonest causes of hearing loss in children. I mean, that which is not congenital or the child is born with. Child is born fine, OAE was fine at birth, and then they develop these kind of problems. I mean, the tonsils enlarge, the adenoids enlarge, and then they have glue ear, that is improper aeration of the ear, the mid ear, and they are able to, they're not able to hear as well. So if a child is snoring, frequent colds, sore throats, see a pediatrician, see your ENT surgeon. So maybe the child is having, it's always better to have the ears checked, whether they are having glue ear or not.
Thank you, Dr. Mohan. I see that we are approaching the hour, so I'm going to run through the last few questions that I had for you. Would you say that hearing loss is a challenge to treat in India?
Of course. I mean, it's see, there is a lack of awareness. I mean, Dr. Harish was on the other day, bemoaning the lack of awareness about mental health issues, and we bemoan the lack of awareness about hearing loss. People do not understand that even a normal hearing adult can suddenly lose hearing, and that sudden hearing loss can be a medical emergency. So there is a severe lack of awareness, and also this disregard for what we say quality of life. I mean, चल तो जाता है, काम तो चल जाता है. You're not enjoying your, you're not able to pick up, the first sounds that your grandchild has uttered. And how sad is that? You're not able to, participate in a conversation at home. It's really sad. So we should be mindful of that, because at the end of the day, towards the twilight of the life, especially, you don't want to be cut off from your surroundings. You need to enjoy that time as well. So be mindful of that.
Sure. And what options are available for treatment of deafness?
See, I mean, there are certain disorders which are correctable. I mean, outer ear and middle ear issues, which are easily correctable by surgery. So far as the inner ear, this sensory neural component is concerned, for that, I mean, sometimes just a plain and simple hearing aid will suffice, and there are hearing aids which are so small that no one will notice. In fact, I have a friend who is a president in a very in a multinational company, Globetrotter. He has hearing loss. He's happily wearing hearing aids. No one knows. No one understands. And he's attending. He's making $1 billion deals. So no one needs to know. No one needs to know. But you have to be mindful of that. And then when the hearing loss is at a stage where it's no more amenable to a hearing aid, we can do cochlear implants, provided all else is fine. That is, the anatomy and everything else is fine. It's very it's not a very huge surgery as such. And these children are doing pretty good. I mean, corrected at the right time. The cutoff age, they say, is by 7 years. If the child is not made to hear, the child will not develop speech. And the later the speech the hearing problem is corrected, the more the handicap the child has. The best age is by 5. Best, maximum is by 5. Best would probably be less than 1. As even in the Western countries, they are doing it below the age of 1. So, yeah.
Thank you. So I'm going to quickly go through some of the questions which had come up from the attendees when we were collecting these questions. So I'm going to ask four questions if time permits. And the first one is, if a child with implant has COVID, what are the implications after recuperation?
See, it's an interesting question. First of all, children, by and large, do pretty well with even with COVID. And that does not mean that they will not have severe problems. There have been reports, but children by far do much better. But just having the implant doesn't, make complicate the issue any further. As far as I know, see, there's a lot that we still need to know. But as far as I can envisage, the problem can arise when there is severe neurological manifestations, because COVID has been known to cause, encephalopathy and, severe damage to the brain. If those parts of the brain which are related to hearing and speech and etc. are affected, then certainly that can be a problem. But then, by and large, just having COVID, asymptomatic COVID, I don't foresee any problem.
Okay, and what exactly is tympanoplasty, and can you tell us whether it is safe?
Tympanoplasty is, just correcting any hole in the eardrum, and the mechanism of the eardrum collecting the vibrations of the sound and transmitting it to the inner ear. So if there is any problem in all of this, if there is any loss of continuity of these bones, or if there's a hole in the eardrum, we do a tympanoplasty. We graft the eardrum. It's very, very safe procedure. I mean, no one needs to worry about that. It's a very simple procedure, and we do so ever so often. So it's not really a problem.
No, I didn't ask you this question earlier. I only talked about children and online schooling, but I believe, and I think, at least personally speaking, the lockdown means I'm talking on the mobile a lot more than I would in office.
Yeah.
And a lot more than I want to. Now, are there some rules of the game as a ENT that you would guide us that, okay, this is how you should be speaking, or right here, left here, or speakerphone or headphones? Just general thoughts about use of mobile phones and
speakerphone. And obviously, there have been studies which have shown that, prolonged use of the mobile phones can affect the hearing and the ear. So, if you can keep that down as much, maybe, do texting or, WhatsApp, and, not prolong the conversation beyond what is absolutely necessary. Not to be curt and, absolutely blunt, but, not prolong it too much. You would obviously know some people who just go on and on the mobile phone, beyond what's needed. That probably should be curtailed, and definitely the volume at which you are playing.
Sure. So there's one live question which has come in, if I may ask you. The attendee is asking about his mother-in-law. So I'm assuming she's 60 plus, who has great hearing in one ear and loss of hearing in the other. She has vertigo intermittently, even though she is on Sturgeon.
Sturgeon.
So are there any suggestions for his?
it's a very interesting thing that this person has brought up. Thank you for that. See, the inner ear has got two parts. The one that I showed you, the snail kind of a structure, that is the cochlea, that is to do with our hearing. The other part is called the vestibule, that is to do with our balance. So, and these are connected. Both these are connected. So, if there are certain conditions which can affect, one part, not the other, and there are certain conditions that can affect both. So, obviously, the inner ear seems to be affected in this situation. The lady has hearing loss as well as balance issues, and she's on Stugeron. Stugeron is a kind of medication that we do not actually prescribe for a long period of time. It is a wonderful medication, but when we use it wisely and for a short period of time, these are a group of medications that we call labyrinthine sedatives. That is, they hamper the process of compensation. If the balance organ is affected, then the rest of the components of the balance system actually kick in over a period of time. They kick in to bring back equilibrium. This process of getting back into equilibrium or adjusting to the new normal, in this to use a phrase, to the new condition, that is affected by Stugeron over a long period of time. This could actually be due to what we call vestibulopathy, or it could be due to this thing. The hearing can be probably be helped with a hearing aid, and for the balance, she needs regular exercises. That is the mainstay of the treatment, not Stugeron.
Okay, thank you. Maybe one last question, Dr. Mohan. What is sensory neural hearing loss?
Sensory neural hearing loss is that hearing loss that comes with, that is to do with the sensory organ, cochlea, and the nerve that conducts the sound from the cochlea to the.
And
so that is what.
And there's a cure for that.
Just what we talked. Now we can't really absolutely cure it, but we can definitely treat it.
Okay. Right. Well, great.
Sorry.
Yes, please.
Sorry to interrupt. I saw, someone, on the live chat, I saw someone mention about genetic counseling. I thought I'd just
please,
say two
yes,
words about it.
I must have missed it. Please go ahead.
Yeah, no, it's just someone said, genetic counseling helps them identify the probability of the thing. It's very interesting. There are certain, communities where consanguineous marriage is common. I come from such community. In fact, I am a child of consanguineous marriage. My parents were cousins. So it's a norm in Andhra Pradesh. So consanguinity can actually cause these kind of not exactly, because there is no dilution of the gene pool. These aberrant genes that cause hearing loss can get accentuated if there are more consanguineous marriages. This is one little thing that I wanted to point out. Just struck me, that's why I mentioned that.
No, thank you very much. Unless there were any other comments, Dr. Mohan, I just wanted to probably just list down some of the takeaways that I noted.
I'm free to take any questions if there are.
Okay, so we'll keep a watch on the live chat, and just to sort of see
this is a gentleman who had mentioned that genetic counseling. I think we've answered that.
Okay, lovely. So I guess clearly the takeaway from the conversation, Dr. Mohan, is that COVID is here to stay. It's not going away, and we have to learn how to live with it, and we have to clearly protect ourselves, and stay fit. With regard to hearing loss, this is something which has a far-reaching consequence if neglected, and better to have it checked, better to get yourself treated if necessary than regret it later, and more so in the case of children. And we've seen WHO's graph where the parents' literacy has a direct correlation to the child's well-being. So like mental health, we need to be aware and seek help early with respect to hearing. And the worst is when you start believing that, well, you are Superman or Superwoman and it can't happen to you. Do not neglect. Make sure you are taking all precautions and keeping yourself safe. Dr. Mohan, it's been a pleasure talking with you. Thank
The
you so
pleasure is
much.
all mine.
Thank you so much for taking the time out on
Thank
a
you.
Sunday,
Thank you for having me on the show.
evening and for joining us. I'm sorry if we couldn't answer some of the questions, some of the live questions. Time has run out. But if there is anything, remember, Dr. Mohan's blog is there. And if you want to reach out to him, if you want to ask him any questions, you have to write
Absolutely.
a surgeon and a dreamer. So thank you once again, Dr. Mohan, for sharing, for being available, and compliments to you for doing what
Thank
you're
you very much.
doing in these times. Video is going to be shared. I'll put it on the group, the link. Thereafter, please feel free to leave the group. It is going to be there on Facebook. And let's see what brings what we bring next Sunday or the week after. But stay tuned, stay in touch. Thank you very much. Stay safe, stay well. Till we meet again.
Thank you
Dr.
very
Mohan,
much.
thank you.
Thank you very much, Mr. Junjanwala, for the wonderful series that you're doing. It's a wonderful thing.
So thank you. Thank you very much. Okay. Bye, everyone.
Bye.